Yes, I think the increased prevalence of Alzheimer's in general is due to age. Average lifespan now is 80. At 85, it's a 50% chance of having the disease, which means you already had the disease at 80, which is the average lifespan. 71 million baby boomers heading toward risk age. Recipe for disaster. What does intrigue me, though, is the growing number of early onset cases we're seeing. Now, is that just because people are speaking up? Did we have the same number of early onset cases before, but it was a stigma, you didn't talk about it? Now they're saying, let's talk about it, maybe you can help me. I don't know, but for some reason we're seeing a greater number of early onset cases under 60 turning up. Well, eventually, when we have the drugs that can prevent the disease, whether it's immunotherapy or oral medications, as soon as you think you're having issues, speak up, because the amyloid's accumulating in the brain to cause this disease 15 years before symptoms, and after 40, we're all starting this pathology. Yeah, this is a disease that 30 and 40-somethings should not be worried about. Not just because of themselves, probably living long enough to get the disease, but because they're probably going to have to take care of their parents, because their parents will live long enough to get this disease. So it used to be that younger people only thought about young people diseases. We see a lot of support, and it's great, AIDS and autism and other young person's diseases. But Alzheimer's now has to become a concern for younger people because they'll live long enough to get it, and they may be spending the best parts of their life after they retire taking care of their parents. This is a disease that hits whole families, right? I mean, it's not just the patient, because when a loved one gets this disease, it's the spouse, first and foremost, who's taking care of the loved one, and it's the children. And you know, when you think about it, you have folks who give their whole lives to their kids, and finally the kids are going off to college. Finally they're thinking about retirement, seeing the world, and now they're stuck at home taking care of their parents. And now that we're living long enough, this is going to be a way of life, not just an exception. Because now we live till 80, 85. Someone in their 40s right now can expect to live till probably 85 or 90, right? Especially if they're living in a healthy way, and many people are having healthier lifestyles. Alzheimer's doesn't care about that. I mean, if it's right now, it's 50% of those at 85. Most people can expect to finish raising their kids, send them off to school, get ready to retire, and then take care of their parents. So it's a terrible problem. I think in the next 5 years, we'll probably have our first therapy, at least well through phase 3, that will help stop the amyloid from forming, whether it's immunotherapy and then later followed by oral medications. We're seeing the first immunotherapies to stop tangle spreading now in trials. Hopefully those are not more than 5 or 10 years out. Inflammation is behind. And this is unfortunate, because in a patient who has the disease right now, you could argue that amyloid and tangles already pushed you up the hill, and now inflammation's thrown you over. And it's really inflammation you have to hit in patients currently with the disease. So the bad news is we just figured out recently what the targets are there. TREM2, CD33, ABCA7, all came out of our genetics work and others' genetics work. But how to hit those is not yet clear. The good news is maybe we'll get lucky fast, because we're not dealing with neurons, we're dealing with glial cells. They're a simpler cell. And as we set up these screens, I call it a microglial chill pill. So if we can get microglial cells to not freak out at Alzheimer's pathology and dead neurons, and keep cleaning up and nurturing rather than becoming like a psycho SWAT team shooting out free radicals, killing more neurons, I think this is how you're really going to help patients with the disease right now. We could get lucky and come up with a drug fast that does that, but that could take much longer than hitting the amyloid and tangles, because we had a head start on those.